Okay, so the next biggest question that I get with IVIG is, how long is this going to take to work? So today we are going to talk about that. So this is going to be a very short video. We're going to talk about what you can expect as far as how quickly IVIG will work. Because again, it's another common question that I get, and I get it because everyone who's embarking on this journey with IVIG, I mean, it's an involved therapy. It's a pain. It can be a pain in the neck. You know, you're dealing with nurses in your home or finding transportation to an infusion suite and not being able to work on the days you're infusing unless you happen to work from home, which many people do nowadays, but it's still a consideration. And they just want to know, you know, if I'm gonna start this journey with IVIG, I need to know when I can expect to feel better. So the way I'm going to answer this is everyone's different.
What?
For the most part, in something like a disease like myasthenia gravis, we'll give IVIG in this case when the patient is in crisis. We do have people that we maintain on IVIG, you know, if they do have frequent relapses. However, a lot of times IVIG is given either at the beginning of what we call an exacerbation or a worsening of symptoms or a recurrence of these symptoms. And in this case, we typically say they can start to feel better fairly soon after the dose, but on average, it's about a month or so afterwards. For other cases, with IVIG and say, you know, peripheral neuropathy or chronic inflammatory demyelinating polyneuropathy, or CIDP for short. In those cases, it may take 6 months to a year for people to see and notice an improvement. You know, I'll never forget, I had one elderly gentleman who you know, came to us because he had lost feeling in his feet to the extent that he drove his car through the living room of his house. He couldn't tell what he was hitting, the gas or the brake, and, you know, wound up driving his car through the front of his living room. Everything turned out to be okay, but in that case, you know, he had pretty significant disease, and when we gave him IVIG, you know, he noticed a difference within a few weeks. Now, some might say, you know, is this a placebo effect? Is this psychological, or is this actually happening? And, you know, it's difficult to say, but on average, patients that are in a crisis, like a myasthenia gravis crisis, will notice an improvement not too long after the initiation of therapy. In general, most physicians will say, or nurses actually will say, that it'll take anywhere from 6 months to a year. So even in the beginning, if you're not experiencing relief, it's the kind of thing that we don't like to give up on too easily, because gradually it may anyway really help you in the end. If you want to watch some of the other videos, click here. Which one are you going to click? And I will see you there.